Okay, we will go ahead and get started. Thank you all for being here. Sorry you're a few minutes late. We're working to get the most updated data and information to you guys. So we had to make a couple phone calls in order to really make sure that we're kind of showing you guys the whole picture. So we'll have an update today from District Health Officer Kevin Dick. It's going to go over some upticks in COVID-19 as well as RSV. Kevin, if you are ready to go ahead and unmute and get started. And we'll have questions available afterwards.
All right. Thank you, Scott. And thank you, everybody, for joining us today. As far as COVID-19 update, we are seeing an increase in COVID-19 cases. Our 7-day moving average is at 51.14 cases per day. So that's up from 37.7 cases that we reported a couple of weeks ago. It's also up over 50% from that level of around 30 new cases per day for the 7-day average that we're kind of bumping along through October. So we're at 325 cases that have been reported over the last week. That's an increase as well from what we've been seeing for weekly cases, and we are also seeing some increases occurring in wastewater. So remember, the reported cases that we get now are only from people that are actually getting the PCR test, and we know that most people at this point are using the at-home test. So the numbers that we have don't really reflect the total number of cases in the community. I think the bottom line message is that we're not done with COVID-19 yet. We were expecting to be seeing some increases as we got into the respiratory virus season, and that's occurring. So I really encourage everybody who hasn't to get updated with the bivalent booster that's available for COVID-19. On the RSV front, we are seeing a very strong uptick in RSV cases. And we could be in for one of the worst RSV seasons that we have had in some time. We had 156 cases that were reported last week, and that's a total of 343 cases that we have reported since October. So we started our respiratory disease season in early October, and we've seen a progressive increase in those cases. The first week we had 8 cases. The second week we had 16 new cases, then an additional 29 cases the following week, up to 54, and then 80, and now 156 new cases reported this week. So it's almost a doubling rate every week that we're seeing, and so that's a cause of concern for us. This is much higher than we are typically or have been at this point in the respiratory virus season. I just spoke with Dr. Lake at the Nevada Hospital Association, and we're at 150% of capacity for our pediatric hospital units now, and we're at 100% capacity for pediatric ICU units, and that's due primarily to flu, RSV, and other respiratory viruses. So while there's no RSV vaccination, there are vaccinations available for the other respiratory viruses of flu and COVID-19. So it's really important that we have everybody pulling together to try to keep our hospital utilization down and those beds available for children that need them. So please have your families get your flu and COVID-19 vaccinations to avoid getting those diseases and help to alleviate people being hospitalized with those viral respiratory diseases. Please check your local pharmacy for COVID-19 and flu vaccines, or call us at 775-328-2427. Symptoms to watch out for RSV are runny nose, a decrease in appetite, coughing, sneezing, fever, and wheezing. Our vulnerable populations are if you have children under 2, please be aware of those symptoms and contact your doctor if they're presenting them. And then if you have a child that's under 6 months of age, symptoms could be irritability, decreased activity, difficulty breathing. Older adults over 65 also have increased risk for respiratory issues and hospitalizations. It's really important to remember that with all of these viral respiratory diseases, we have similar protection and prevention approaches. We want to protect vulnerable populations, and we want everybody to remember what we were doing during COVID and be more vigilant. We need people to stay at home if they're sick. We want people to make sure that they're washing their hands, washing them thoroughly for 20 seconds and doing it often. Avoid touching your face, particularly with unwashed hands, and frequently clean common touch surfaces. This will all help in preventing the spread of disease. And also want to remind people that, older children, adults that have some resistance, immunity to RSV may not get severely sick. They may have a minor cold, but that could be RSV, and it could be then passed along to other more vulnerable populations. So don't just take for granted if you have a cold and a runny nose and it's no big deal. Please try to stay away from work and others until you get better, prevent the spread of disease in our community. And we have Thanksgiving approaching, and so it's also important with those gatherings coming up to remember these prevention methods. And please, if you are not feeling well, please avoid going to those gatherings where you could be spreading this to other people. So with that, Scott, I'll wrap up my briefing and turn it back over to you.
All right, thank you very much, Kevin. So we will now open it up for questions. Not only will Kevin Dick, District Health Officer, be on, we have Lisa Lotritz, who's our Division Director of Community and Clinical Health Services at the Health District, and Dr. Nancy Dow, our Division Director of Epidemiology and Public Health Preparedness. So if you have any questions for each of those, please specify. I will stop talking. So if you have any questions, please go ahead.
Scott, I'm seeing a question in the chat on what's the status on flu right now, and maybe Dr. Dow could answer that.
So we are seeing upticks overall in our influenza-like illness activities. In terms of flu hospitalization, there is more of an uptick in flu hospitalization as well. So we are definitely hitting the season with the so-called triple threat that's happening, what has been described. You've seen a lot in other regions. So definitely is something to watch for. We do also see co-infections that's happening with flu and RSV. And COVID and RSV at the same time.
Okay, I'm not, are there any other questions that anyone wants to ask? You can either put it in the chat or just go ahead and say it. Looks like we got one. Nope. Okay. Thank you very much for joining us. Reach out to me if you have any clarifications or any other questions. We'll post this still on our COVID-19 Washoe.com site under press conferences. Thanks to all of our speakers and have a great day. Also, the numbers that Kevin shared on the RSV, we're going to issue a press release with that information in it. So that'll be out hopefully very soon. So be on the lookout for that. And that's all we got. Thank you very much. Have a great day.